Can prednisone cause eye side effects? Yes. Prednisone can cause at least 9 types of side effects that affect your eyes. I'm Dr. Megan, your prednisone pharmacist, and I personally experienced some of these when I had to take prednisone for 9 months. I'm going to go through all 9 of them, from the most legitimate and common side effects to those that are more conjecture and possibilities associated with prednisone use. So the number 1 most damaging and legitimate side effect of prednisone on your eyes is called cataracts. It's blurry vision and low light difficulty seeing. And normally cataracts happen only in old people, but this specific type of cataract, eye doctors can see, and it's called a posterior subcapsular cataract. And this is permanent damage. There is nothing you can do aside from having cataract surgery, removing the lens and replacing it with a new one. Luckily, it is reversible in that way. But aside from that, the damage is progressive, and only when you stop taking it does the damage stop progressing, but it does not go away on its own. How many people get cataracts? Well, in one study, 39% of patients with rheumatoid arthritis got cataracts after 1 year of treatment. I think that was probably a really kind of the highest level. I don't think really 4 out of 10 people taking prednisone get cataracts. Another study of 230 people with lupus, only 6 of them got cataracts. While it's more likely to happen at doses of 10 milligrams and above, even a dose of less than 5 milligrams per day can cause cataracts. And when I did the research for this, I compiled information from drug information resources like the well-respected medical references and drug information references that doctors and pharmacists use. And I looked at patient surveys and patient support groups for gathering all of the information I could, because there's actually no perfect resource when it comes to prednisone. The information out there is not complete. And so I had to gather all I could to try to give you the best picture. And so that first side effect came from 5 of those sources. This second side effect is also potentially irreversible, and it is called glaucoma. And glaucoma is the final end product of something that I'm going to lump in with it called ocular hypertension. So this is when you have high pressure inside your eyeball. That high pressure, just imagine like a water balloon getting more and more pressure from being filled up with fluid. And then what does a water balloon do when it has too much fluid? It explodes, right? Well, I don't think your eyeball is going to explode, but it can cause damage. And so one person wrote me, and this is what he said. Prednisone Warrior Jim. He said, I started taking 80 milligrams of prednisone a day for GCA and polymyalgia in August of 2022. My prednisone end date was February of 2024, so that's a year and a half of treatment. I developed ocular hypertension in one eye and have lost a lot of vision from damage to the optic nerve. So he has 2 questions. Will prednisone-induced ocular hypertension return to normal ocular pressure levels after prednisone has been discontinued? And question 2, how long will it take for the ocular pressure to return to normal or near normal levels after prednisone has been discontinued? So unfortunately for Jim, this damage to the optic nerve isn't going to go away. The damage to his vision isn't going to go away, but the pressure can go away. So stopping treatment with prednisone or other glucocorticoid leads to reversal of the high pressures after 2 weeks. And then the pressure appears to normalize at that point. If it's not the case for you, then definitely talk to your eye doctor. But generally, yes, it does go away once you stop taking it, and it's usually about 2 weeks. To answer your 2 questions, Jim. The thing about ocular hypertension is that you cannot feel it happening. So you can have painless increase in pressure and it doesn't notify you in any way until your vision is lost. You don't know it's there. And even the vision loss can be hard to detect as well. It can be hard to know that you aren't seeing things because you can't see things you can't see, right? And the important thing about ocular hypertension is it can happen from any type of steroid, whether it is the eye drop kind or the pill that most people take, or an IV, or an intramuscular injection in your rear end, or cream, any of them can cause an increase in the eye pressures. And so this is something for everybody taking any form of corticosteroid to worry about. The next one is very rare, but 3 sources support it. It is called central serous chorioretinopathy. Try saying that 10 times fast. A prednisone warrior named Dave, he shared his story with me. He had been taking prednisone for 20 years, and he took 5 milligrams 3 times a day, breakfast, lunch, and dinner. His eye doctor said if he stopped taking the prednisone, his condition would go away. Problem is, he's been on it for 20 years, and he doesn't really have a way to get off of it. Number 4 is corneal perforation. It's damage to the cornea. It's kind of like poking a hole in your cornea. And it can happen, but it's really rare. And it's reported in 2 sources. Number 5 is eyelid swelling. I personally experienced this where just one eyelid would just get swollen. I just wake up and suddenly one eyelid was really swollen. The fancy medical term for this is blepharitis. And it wasn't that I had an infection. It was just full of fluid. Only one medical source shows this, but I know I'm not alone because people post this in support groups all the time. Number 6 is blurry vision. And this is reversible, but it can be really scary because it can be a symptom of cataracts and other eye damage. And so if you're having sudden blurry vision like I did, it's possible nothing to worry about, but it also could be something to worry about. And so this is one you definitely want to make an appointment with an eye doctor to make sure it's not something else. Number 7 is dry eyes. Now, I don't actually have any sources for this aside from support groups. And so I'm wondering if this is actually a symptom of somebody's disease or a side effect from another medication they're taking, but people have reported prednisone causing dry eyes. And these last 2 side effects are more conjecture based on other side effects happening that we know definitely happen and the consequences of those side effects on your eyes. So people often take prednisone as an immunosuppressant to turn down the immune system's overreactive response that's leading to an autoimmune condition. That's the reason I personally took it. And therefore, prednisone is affecting the immune system. So theoretically, these effects could increase your risk for eye infections because you don't have as much of a robust immune response when it comes to your eyeballs. So potentially you have an increased risk for viral infections, for herpes infections, and basically any kind of infection in general, from sepsis to eye infections, but there's just not a lot of research showing this because it's not that common. And finally, number 9 possible eye side effect is diabetic retinopathy. Now, prednisone is a glucocorticoid, meaning it affects the glucose blood sugar system in your body. When glucose gets too high, that leads to diabetes. And diabetes leads to tons of complications like diabetic retinopathy. And this is when there is a problem in the retina of your eye. Often people who have diabetes end up going blind because of the damage to the little teeny tiny blood vessels in your eyeball. And that damage is permanent. And so it's a possible side effect, but it's not really mentioned in the scientific literature. It's more like they mention diabetes, and so you kind of just infer, oh, they have diabetes, now all of these complications are possible. So there you have it, the 9 possible eye-related side effects from prednisone. So what can you do about it? Well, I've mentioned several times, you should make an appointment and be seen by an eye doctor at least every year, if not every 6 months, and whenever you're worrying about vision changes that you're experiencing. If you're older or you have a risk for high pressures in your eyeballs, definitely take precautions. There are eye drops you can be taking, and making an appointment with your doctor is definitely the best choice. But it's not just your eyes that prednisone can affect. That's literally one of the many parts of your body that can be affected by prednisone. If you're wanting to know tips like the ones I've just shared about how to manage eye side effects, about these other many side effects that prednisone can have on your body, I created the prednisone checklist. It has all the things you need to be checking out with your doctor or on your own to make sure you're staying healthy while on prednisone, to minimize the side effects and counteract them so that you can feel like yourself again while taking prednisone. Just click the link below to download it now. Signing off is Dr. Megan, your prednisone pharmacist.